MMT, hip external rotation, internal and external obturators, superior and inferior gemelli, piriformis, quadratus femoris, and gluteus maximus. Assist the patient to the short sitting position with their feet supported by a stool or on the floor. The trunk may be supported by placing the hands flat or fisted at the sides. Place a towel roll under the distal thigh. Sit on a low stool or kneel slightly in front and to the side of the leg being tested. Passively move the patient's hip through external rotation. You are not assessing the infield. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to externally rotate the hip as you observe for any substitutions. Stabilize the patient at the distal femur just proximal to the knee. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the following: lifting the contralateral buttock off the table or leaning the trunk in any direction to lift the pelvis, increased flexion of the test knee or hip, and abduction of the test hip. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the distal lateral aspect of the femur with your hand just proximal to the knee. This hand will offer counter pressure in a medial direction. Place your other hand just above the medial malleolus of the test leg. This hand will apply the resistance in a lateral direction. The two forces are applied in counter directions for this rotary motion. Grade 5, normal. The hip externally rotated to the available range of motion and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Hip externally rotated to the available range of motion and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in hip external rotation, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into the supine position. Position the test limb in internal rotation. The gravity-eliminated position of the therapist is to stand on the side of the leg being tested. One hand is placed on the pelvis to maintain neutral alignment. Observe the hip for any extraneous motions. Ask the patient to externally rotate the leg. Grade 2, poor. The patient completes full range of motion in the supine position. Grade 1, trace. There is partial range of motion. The external rotators are not palpable except for the gluteus maximus. Grade 0, no movement.